be with everyone today. I want to get started with a question for you all. We have a fair amount of participants, and if this topic was resonating with you, I will assume that, like many Americans, there is something causing you stress this holiday season. So I want to just take a couple seconds here. If you have a pen and paper, use it. But what are the people, places, things causing you stress this holiday season? What are the situations? And I want to just take a couple seconds for you all to think about that and jot it down. And I'll even jot down a couple things that are stressing me out, because I definitely have them. Okay, now that we've had a couple seconds to think about the holiday triggers that you are experiencing, my next question is rhetorical. What can you do to cope with those? What can you do to help manage your stress and anxiety? And I will be talking, a lot of the stress that comes up during the holiday season, might be out of our control. It could be systemic issues or issues in our family or people who have died. And a lot of that stuff is out of our immediate control. So I'll really be focusing on, not that I don't think that we can't do things to help with issues like systemic stress, but on an individual basis right now in this moment, in this holiday season, what can you do to cope with that stress and anxiety? And that, of course, is our topic for today. I am Dr. Brian. I'm really pleased to be with you all here. Like Jolie said, I am a child and adolescent psychologist at Instride Health. Before we get to, I'll be talking again about those practical tips to help you deal with the stress of the holiday season. I'll be giving just a short overview of holiday stress. I'll talk about CBT to better understand your holiday stress and anxiety so that you can more effectively use those tips. And then we will finish today with just a couple of my special considerations for populations of interest for me that I specialize in that can come up during this time, and then a question and answer. Now, I will say I do have the Q&A pulled up right now, and so if folks, I'll try to, if it's relevant, I'll try to get to your questions as we go along, and then of course we can kind of save some for the end as well. Okay, again, I might be doing a little bit of preaching to the choir here as I talk about our holiday stress overview. Again, if you are attending this talk, perhaps you fall into the category of almost a majority here of us, 41% in a survey done last year by the American Psychological Association, say that our stress increases during this holiday season. About a half says the same. And then I'd really be curious to talk to the 7% who say that their stress decreases. But of course, alongside stress, the holidays can also be a time for a lot of fun and joy as well. And so perhaps that's what's going on there. But for a lot of us, either our stress is going to just stay the same or it will increase. On the whole, about 9 out of 10 US adults will say that something is causing them stress during the holiday season, even if their overall stress level isn't increasing. Almost all of us are kind of saying that, hey, there's at least something about the holidays that's stressing me out. Again, a lot of it can be joyful and fun, and there's a lot of stress that goes along with the holidays. Let me just go over a couple commonly reported sources of stress. This is not going to be an all-inclusive list. When we did that exercise in the beginning, and I had you all write down kind of what's stressing you out. Some of these might pertain, but again, this is just a couple commonly reported sources. Financial strain. So you might be worried about, I'm going to be spending too much money. Of course, not having enough money to spend is another common concern. By expectations, I might, You might be having trouble finding the right gifts for people, just overall feeling pressure to make the holidays a really, really special time. There can be a lot of sadness, loneliness, or grief that shows up during this time. Missing family or loved ones, um, not being able to spend time with family or loved ones, feeling just left out or excluded. Logistical challenges. These might include just so much to do, figuratively, a lot on your plate, having to see a lot of people, a lot of extra events, traveling as well. Of course, not all families live in the same place or friends, and you might be flying or driving to see people. Family conflict. Even if you don't experience family conflict during your holiday season, there might even just be anticipatory stress of, might my family come into conflict? And I did already see a question in the chat, which is excellent, about just family conflict, family stress related to how people voted, what happened with the election. And so hopefully I can speak a little bit to that. But that sounds like that in particular is resonating already, the family conflict piece. And then, of course, if you do struggle with food or alcohol related issues, this can be a particularly challenging time. Events that you go to might have alcohol in a ton of food as well. So that can be very tricky for a number of reasons. Okay, so I did mention I wanted to briefly talk about using cognitive behavioral therapy, which is what I mean by CBT, to better understand the holiday stress and anxiety that you are going through. Because again, it's going to be a lot of those stressors we're going to have in common, and a lot are going to be different for us. And I might be really stressed out. I'll give an example about maybe giving gifts for me. You might be the type of person that loves to give gifts and find a lot of joy and excitement about that. So this is all very individual in terms of what stressors we are going through and how exactly that pertains to us. So when I'm talking about cognitive behavioral therapy, or CBT, what I mean by that is the feelings that we're experiencing, that stress, that anxiety, how that manifests itself physically, those physical symptoms. Those feelings and physical sensations are related to our thoughts, the images running through our head, the words running through our mind, which are in turn connected to our behaviors, the things we do, or perhaps the urges that we have. And that is the basic, very, very basic premise of what cognitive behavioral therapy is. Let me go through a specific example related to the holidays to illustrate this a little better. So like I talked about gift shopping. I don't know if anybody wrote down gift shopping at the top of our presentation here, but that can be a really big stressor, and it certainly is for me. And so I might have a lot of stress around this trigger. I might feel really, really tense and nervous. And I might even have other feelings too, like sadness. Why am I feeling stressed? What am I worried about happening? My daughter might not like the gift that I can buy her, right? I might worry, man, I'm going to be a terrible dad. And I am no stranger to using procrastination and distraction to deal with really unpleasant feelings, which can be a very common response for us. Because when we get overwhelmed, oftentimes our response is to push those feelings away. So coming back to the top of our presentation, what did you write down? What were the people, places, things, events, situations that are stressing you out right now? And after our presentation today, after our hour, I'd love for you to go through and write down, okay, what feelings are showing up for you? How is this making you feel, the situation? Is it stress or anxiety? Is it sadness? Is it grief? Why? Well, how are you seeing this situation? What's your perspective? What thoughts are showing up for you? And then what behaviors have you done around this issue? Or what urges do you have to do around this issue? Can be really, really helpful. Again, in a moment here, I will talk about practical tips, but to really make these practical tips as effective as possible, it is really, really helpful to develop more awareness around how you're feeling thinking and how you're responding right now. Okay. And I do want to get to those practical tips because I know a good part of people are experiencing this. And so, kind of, again, depending on what's showing up for you, what thoughts, feelings, and behaviors are showing up for you, some of these might be helpful, some might not be helpful, just to, again, depending on exactly what is happening for you. Okay. I do love this one, and I really would highly recommend this probably for everyone, frankly. But let's imagine that your well-being is a piggy bank. And the headline here is, we want to put coins in your bank. So what depletes your mental well-being over the holidays? What fills up your piggy bank over the holidays? Are you someone who thrives on social interactions, in crowded events, or do you recharge through more quiet moments on your own? What people, places, things, events, traditions are adding coins to your bank of well-being, and what people, places, things, events are removing them? So the goal here is just to become mindful of how empty or full your bank is and what's affecting that. And after you've developed a little awareness and been thoughtful about what depletes or fills up your bank, the goal is then to be more proactive about putting coins in your bank rather than waiting for them to be depleted. So you can next brainstorm a list of things that put coins in your bank. And if it's helpful, you can split this into things to do before an event, during an event, and then after holiday activities. And these are just some examples that I have listed here. They absolutely don't have to be something that fills up your bank, but before, for example, you might exercise, meditate, take some time to breathe, listen to music, or just have some quiet time. During an event, perhaps you can go to the bathroom to take a break, talk to a specific person who really fills you up, or you might rely on some mantras to help get you through that event. And then after, again, maybe exercise helps you decompress, quiet time, having a warm bath, holiday movie. Being in Cleveland, I have to, of course, recommend A Christmas Story, or maybe debriefing with a friend could be helpful for you. Again, those are just some examples, but those might things that actually deplete your bank. But if there are things that fill up your bank, feel free to use that and kind of keep brainstorming from there. And then again, be proactive. Don't wait for your bank to be depleted. Put those coins in the bank, be proactive about this, try those coin filling activities, and notice how does that affect you, your thoughts, feelings, coming back to the cognitive behavioral therapy, how does that affect your thoughts, feelings, and behaviors? And so you can kind of rinse and repeat. If you noticed, oh, listening to music was really helpful before I went in and did this, keep doing that. If you notice, oh, actually a holiday movie wasn't really helpful after the event, and it would have been more helpful maybe to talk to a friend, you can kind of trial and error as you go along. And I am looking at the question and answer segment. I'm having a little bit of a harder time following the chat, but I'm trying to look at the Q&A. And so thinking about, if you are experiencing or family conflict, whether that's around the election or anything else, this is definitely something that could apply. What are things that you could do during a family get together before, during, or after to try to kind of fill up your bank? We'll also talk about some other things that you could do there, but that definitely applies to this. Okay. Next, I'm going to talk about connecting to your values. And by values, I mean the sort of person that you want to be, how you want to behave and live your life, how you would like to treat other people, yourself, the world around you. And my little value blurb gives a little bit of an idea of what I'm talking about here. Do you really care about being an authentic person who's living true to yourself? Do you care about having a sense of adventure? Are you really connected to compassion or kindness? And it can be a really, really helpful exercise if you haven't done this before to identify what values, what are the things that you really care about? How do you want to be as a person in your life? And you can then also think about specifically, okay, looking at this holiday season, what do I really care about? I might really care about connection and the relationships. Also, maybe fun and humor. I would love to just enjoy myself and have a joyful holiday season. So you can go through and identify your values. And then I want to make a couple points about values. When we are moving towards our values, and what I mean by a towards move is being the type of person that you want to be, living the type that you want to have. Moving towards your values is not always comfortable. So I know in the last slide, I did talk about kind of comfortable things that fill up your bank. This also can coexist with knowing that when I am being the type of person that I want to be, that's not always within my comfort zone. So it's important to fill up your bank, but not so much that you're getting trapped in a cycle of avoiding unpleasant things or situations. So again, moving towards the type of person that we want to be is not always comfortable. For example, coming back to the family conflict, it might be really helpful for you, and it might be a towards move for you to be able to set boundaries with relatives. Perhaps if you would rather just connect with your family without talking about politics, perhaps you can proactively communicate that boundary or desire before meeting with your family. And then maybe you can have kind of a short go-to to redirect or change the conversation if that does show up. Kind of setting those boundaries can be really hard to do. And that might be a towards move for you. If you are someone who struggles with social anxiety, that can be a really big trigger during this holiday season. It might be moving you towards your values if you face your fear of social situations and put yourself outside your comfort zone and socialize. So again, not necessarily a piggy bank filling activity, but something that would be important for you to do nonetheless. And then sometimes I talked about procrastination and distraction. Sometimes it can just be tough to get out of your bed and do something. So it might be more comfortable for me to sit on the couch and play Zelda all day. And it's still important for me to get things done, attack my to-do list. That still might be a really big towards move for me. The other point that I'll make, values are different from goals. So we talked about the expectations that we have for the holiday season a little bit earlier. And you might have certain goals in mind that you would like to achieve during the holiday season, whether it's seeing certain people, doing certain things, etc., which may or may not pan out. However, values are something that you can tap into at any time. So maybe you were planning on spending the holidays in Michigan. Guess what? Michigan just got hit with a huge snowstorm and it would be unsafe for us to drive. So even if that goal wasn't achieved, I can still connect to my value of connection by focusing on that value in the present with what I'm doing right now, even if that goal doesn't pan out. Values are super, super important to consider. Okay, next I want to talk about thoughts and how you can effectively manage thoughts that might show up for you this holiday season, because the holiday season absolutely can trigger scary, upsetting, self-defeating thoughts. And those thoughts are very easy for us to get hooked by, controlled by. They can very easily get stuck in our head. And so when this happens, like we talked about earlier with the CBT triangle, thoughts, feelings, behaviors, one first important step is really to just start to bring more awareness to this cycle happening. When you're noticing those thoughts getting stuck in your mind and getting really hooked and controlled by them, what thoughts are showing up for you? Bring awareness to that. How are those thoughts making you feel? In your physical sensations, bring more awareness to that. And then behaviors, again, what's your urge to respond in that situation, or how are you actually responding in that situation? What are you doing? And this is speaking to the point, the second question that I have in the chat here of considering that a majority of people experience holiday stress. Is it worth trying to change something about this, or should you focus on exercising acceptance and integration in our lives? And when we then talk about responding flexibly to those unhelpful thoughts, that's where perhaps you can exercise acceptance and say, kind of jumping to that last bullet point of unhooking, accepting that a lot of stress is something that is genuinely stressful. I'll talk a little bit about changing the thoughts, but you might be going through a stressor that truly is, it's stressful. There's no changing our thought out of that. It's just a stressful situation, but we can accept that stress. We can create space for it and then refocus on what's important to us in that moment. What are those values that we care about? What are those towards moves? I am stressed, and I also want to be the type of person that I would try to shoot for in this holiday season. Now, a lot of the unhelpful, scary, upsetting thoughts that you might have might be helpful to reinterpret those thoughts. Always good. A good mantra, especially, is thoughts are not facts. Even though I worry my daughter might not like the gift I got her, she's fairly easily pleased. What's happened in past years? Is there another way I can see the situation? Has she enjoyed the gifts I got her in past years? Are there any hints of things that she might like? Are you the type of person who would just ask, hey, what do you want? Right? So there are going to be a fair amount of unhelpful thoughts that you might be having in this holiday season that you can reinterpret. And if you're the type of person that's really, really hard on yourself and more helpful to a friend, you can always ask as well, what would a helpful friend tell you in this situation? That usually can bring some more kindness and compassion to your situation. So I appreciate that question from Tudor, and hopefully I covered that fairly well. All right, and last but not least, some of these holiday situations can be really upsetting and triggering. And so if you are kind of starting to get overwhelmed, again, I think of like the family conflict question, please talk about added stress due to election and holidays and families voting differently. That might be a situation where the stress level is really starting to rise and you're starting to get really overwhelmed. And so I'm just going to go over a couple different coping skills, which might help, but you might have some others that you really like or go to, or can kind of look at other resources. So when you are feeling overwhelmed, these are a kind of couple SOS, if you will, coping skills that you might have. 4-7-8 breathing is breathing in on a count of 4, holding for a count of 7, and breathing out for a count of 8. And we might even just practice this really quickly together to see how it affects your feelings. There are other breathing exercises that could be helpful, whether that's belly breathing or diaphragmatic breathing or another breathing technique. This is one that I really, really like and encourage folks to use, but it might be something else that you prefer. Dropping anchor is when we first acknowledge when we're feeling stressed, we acknowledge the thoughts and feelings that we're having. So, oh gosh, I'm really stressed out about paying all this money for gifts. I'm noticing a lot of stress. I'm noticing a lot of tenseness. So just acknowledging whatever's showing up for you. And then the second step, I'm going to come back to my body. I might stretch my hands and arms. I might do a twist. I might take a nice deep breath. Kind of whatever's comfortable for you to coming back into your body in the situation. I might get up, and I won't get up here, but I might get up and just take a quick walk. And then re-engaging in the present. What am I doing? Okay, I am at an ADAA presentation. I'm leading this presentation. Re-engaging in the present moment. And then last but not least, 5, 4, 3, 2, 1. What are 5 things that you can see? 4 things that you can touch? 3 things that you can hear? 2 things you can smell? 1 thing you can taste? So again, kind of bringing you back into the present moment with what's going on in the situation. Of course, a lot of these are at baseline a lot easier said than done when those stress levels are rising. That's when it's particularly hard to use these skills. but it is really nice to have a go-to in case you are anticipating feeling overwhelmed. Okay, and Anna Parker asked a really great question about how well these work when you can't get time alone. Are there other techniques that would be less noticeable? I do think that some of these can be a little discreet when you're doing them. If I was dropping anchor and coming back into my body, for example, I might not, stretch like this, but maybe just push my feet into the floor, do something more discreet. Or perhaps it would just be helpful if you are feeling really overwhelmed in a situation to just take a break, excuse yourself, go to the bathroom, and use that time to bring a coping skill to help you deal with your feelings and decompress for a minute or two. Again, these are just some things to try. They may or may not resonate. And it's important to have something else to go to if you're feeling stressed. Okay, last but not least, I appreciate y'all's time. I did want to talk about, I specialize in anxiety problems and obsessive compulsive problems. That is our area of focus at Instride Health. We specialize in treating kids and teens who have anxiety problems and or obsessive compulsive problems. And so I wanted to talk about some specific populations of interest for me. I'll start with ARFID. ARFID is avoidant restrictive food intake disorder. And this is when, as a very general description, when someone has difficulty eating an appropriate variety of foods and or volume of foods. And so this is one of those issues that can really be triggering during the holiday season, because guess what we have at Thanksgiving? All these different foods that we never eat at any other time. In other holiday celebrations, again, similar thing. And so first and foremost, exposures towards moves. And this is going to be something I say for all three of these, because what we know for anxiety problems, obsessive compulsive problems, exposure, getting outside of your comfort zone. We're not trying to torture anyone for fun, of course. We're trying to help you to be the type of person that you would want to be. That's why I also call them towards moves. Right? It really might be scary for me to try the cranberry sauce. And right, there are many, many other reasons to eat foods other than what I prefer taste-wise, right? If I just eat what I want to taste-wise, I might just end up eating Nerds gummy clusters all day long. But that wouldn't be good for my nutrition. It wouldn't be good for my physical health if I just ate one thing. There are social reasons, of course, to be able to eat more flexibly. So in any case, and I will say for each of these issues, social anxiety and then OCD, it is really important to do exposures and towards moves throughout the season. And, I want you all, if this is something that you struggle with, or if you have an anxiety disorder or OCD, I do want you enjoying yourself and not stressing yourself out too much. So always keeping the exposures and the towards moves within a attainable range for you. Food issues can come a lot up with family or friends, because they're noticing, hey, you just have, buns on your plate or whatever, and people can make comments. So it can be helpful for ARFID in particular. We did talk a little bit about proactive communication. I think that that's a tip that can be applied across issues. Proactively communicating with family or friends, maybe they don't know about your food issue, and you can kind of tell them, hey, this is something that I'm working on. And then maybe if someone does end up saying something that might be a little bit off taste in the moment, to have a response ready to go. If someone makes something that you just don't want to talk about your food issues because you're working on that, what's something that you can say in the moment to deflect, or say, hey, I know that you don't mean anything by this, and I just don't want to talk about food right now, that type of thing. Social anxiety disorder, we did talk a little bit about already how there are so many social issues and social triggers during the season, a lot of events, a lot of people that you might see. And so exposures, again, super, super important. We're not trying to just get uncomfortable for the sake of being uncomfortable, right? Do you want to connect with other people? Do you want to enjoy other people in a social situation, right? You might have very, very good reasons to do exposures if you have social anxiety. And then the other thing that I think of, we already talked about the piggy bank, so I won't go over that again, but I think the piggy bank in particular can be really helpful for social anxiety, because you might be going to so many events, or even not many, but just the ones that you do go to might be really draining. So also thinking about, okay, it's important for me to get outside my comfort zone, and what can I do to kind of fill up my bank and restore my mental well-being. And then last but not least, OCD is such a broad, have such a number of triggers here for the holiday season, whether that's contamination or religious or scrupulosity oriented OCD. And so again, exposures towards moods, really, really important. And those are things that you're doing to get outside of your comfort zone. And again, not just for the sake of being uncomfortable, but so that you're the type of person that you would want to be. And Anna Parker is asking, what does an exposure mean? And so I do want to speak a little bit more to that. So for example, if I'm the type of person who has social anxiety, I might be really worried about what people are thinking of me. Are you thinking I'm an idiot? Are you thinking that this presentation is terrible? And so instead of avoiding that anxiety, I'm going to get up and give a presentation, even though I do have some anxiety about people judging me. If I have a really hard time eating different foods, an exposure for me would be to try different foods, try new foods, different tastes, different textures, as in the case of ARFID, for example. And then OCD, there are many, many, many different exposure exercises you could do to face your fears, because OCD is so varied in the different types. It might include going to a party and washing your hands less. It might include, just as one example, I know there are many different types of OCD. And then with OCD, the response prevention or not ritualizing is really, really key. And so if you can not ritualize and stick in that doubt, so doubt, delay, distract, tolerate that uncertainty of it's possible something bad might happen. It is possible something bad might come true. That would be ideal. If that's getting really overwhelming, to delay those rituals. And then if that's still getting really, really hard, to use something as a distraction during this holiday season. So a couple options there. All right. And that is all from me. I know I've been looking at the Q&A as I've been going along, and I think let me go back to that. I think, Jolie, I'm going to put my screen down. But I appreciate, before I go back to the question answer, really appreciate everybody's time today, and thank you for the questions that have already come in.